Tooth eruption and formation of the periodontium. Welcome to this session. This will be a quick synopsis of what we know and what we don't know about how teeth erupt and the processes that control the final stages of formation of the periodontium. An understanding of eruption in particular is important for two very practical reasons. First, certain orthodontic and functional dental problems can be avoided or minimized if you understand the concepts and biology of tooth eruption. Secondly, when you begin practicing dentistry, you will quickly learn that every patient will expect you to be an expert in explaining when, how, and why teeth erupt in young children and adolescents. Clear and informed answers to their questions can help resolve their anxieties and also confirm to them that you know what you're talking about. First, please review these learning objectives. Any questions asked in examinations will be based on these objectives. So, tooth eruption is defined as the movement of the developing tooth germ or bud from its developmental crypt in the alveolar bone into the oral cavity and then into functional and sustained occlusion. Before we consider the cellular and molecular mechanisms involved, let's first consider some basic clinical rules about tooth eruption.
First, in humans, there are two cycles of eruption, one involving the primary or the initial deciduous teeth, ranging from about 6 months of age to about 2.5 years of age, and then the more extended cycle involving eruption of the secondary or permanent teeth. This secondary cycle ranges from about 6 years of age to 20 years of age, the latter being for the eruption of the third molars or wisdom teeth. The second cycle is the one we generally focus on as it's more complex and it involves the coordination of resorption and exfoliation of the primary teeth, their replacement by succedaneous teeth, and also the eruption of the permanent molar teeth, which have no primary analogs.
Almost as soon as the primary tooth has fully erupted and root formation is complete, the process of root resorption of the primary tooth begins, triggered by eruptive signals from the underlying or secondary tooth germ. The secondary tooth germ erupts typically apical to the primary tooth, or in the case of the anterior teeth, slightly lingual to the primary teeth. The time between exfoliation of the primary tooth and the eruption of the secondary successor is typically 1 month. That's an important time span to remember since parents tend to get anxious about whether a secondary tooth exists, and also a time when we should be ready to calm their concerns as clinicians. So these are important concepts when treating children in your practice. Now let's look into some of the biology involved. On an individual basis, each tooth erupts after crown formation is complete. As the root begins to form, we see some signs of eruption. There's an expected order, timing, and sequence to the eruption of certain subsets of teeth. These subsets being the maxillary versus mandibular incisors, bicuspids, canines, and molars. That said, there are also huge variations in the sequence of eruption, individual to individual. Teeth erupt in a three-dimensional manner, not just occlusally, but also in the buccolingual and mesiodistal planes. Our genetics has a major influence on the occlusal patterns or orthodontic arrangements that develop. Let's go on. For each tooth, there are 3 phases of eruption: the intraosseous phase, the supraosseous phase, and the post-functional phase. I'm going to let you read up on that last phase, the post-functional phase, on your own. The intraosseous phase is the slowest phase because it's within bone. And in there, tooth movement is only about 1 to 10 microns per day. The supraosseous phase, which follows intraosseous eruption, and as the tooth moves through the overall gingiva and into the oral cavity, is much faster, about 75 microns per day. What I'm about to tell you next may surprise you, and it's sort of counterintuitive. Root growth and formation of the periodontal ligament only play a minor role in tooth eruption. In fact, we know from experiments that teeth still erupt even if the root does not grow or if the periodontal ligament does not develop. The one most important process in tooth eruption is this: robust bone formation apical to the forming tooth as root development is occurring. This robust bone formation serves to build the alveolar ridge, and in the process moves the tooth as a unit occlusally. Conveniently, it also occurs as bone is being resorbed over the crown of the tooth, and we believe that these two processes, bone formation apically and bone resorption occlusally, are tightly linked. More on that in a few minutes. Later in development, as the tooth moves into the superosseous phase, root growth eventually outpaces the formation of apical bone, and the tooth with its root moves as a unit out of the alveolar crypt into the oral cavity, and then eventually into occlusal contact. The periodontal ligament fibers forming around the tooth are thought to play a minor but still important role in directing the tooth towards the occlusal arch based on how occlusal forces are detected and interpreted by the neural and fibrous elements of the periodontal ligament. Our best evidence to date suggests that eruption is triggered and sustained by epithelial-mesenchymal interactions, sometimes called EM interactions, similar to those which occur in crown and root formation. You've heard about these before. We believe that once crown formation is complete, certain time cellular events takes place. First, the enamel organ overlying the crown, and specifically the epithelial cells of the stellate reticulum, produce molecular mediators that direct the cells of the neighboring dental follicle to do certain critical things. Examples of these epithelial mediators are IL-1 and TGF-beta. These factors then in turn trigger the increased production of CSF, colony stimulating factor, in the dental follicle, lying over and around the crown. Increased CSF results in a downregulation of osteoprotegerin, OPG, which you might recall is a decoy molecule for rank. Less OPG in that area means that we have increased rank ligand interactions in the follicle overlying the crown, and therefore the increased recruitment of osteoclasts into this region. While these processes increase root resorption in the coronal areas, it's thought that other mediators induce increased bone formation in the apical areas, with the net effect that the tooth complex moves coronally and occlusally. Voila, we have eruption. So again, we have a very important role of epithelium-mesenchymal interactions in another tooth development process, namely eruption. I'd like that you read further on how, on the formation of these following tissues of the periodontium as the eruption occurs. First, the formation of the junctional epithelium, a tissue that is going to be very important to you in the periodontal care of your future patients. The junctional epithelium forms initially as the result of the fusion of the reduced enamel epithelium on the erupting crown and the oral epithelium. It is important for you to know that the junctional epithelium is initially derived from the reduced enamel epithelium. This is another question that often appears on national boards. Secondly, please review again the names and characteristics of the major or principal fibers of the gingiva and the periodontal ligament. These are not hard to understand, but need some attention by you. Please know which fibers provide the greatest support to the functioning tooth. Finally, please recognize that the most important tissue in tooth eruption is again the dental follicle, as we've seen in other processes. It ultimately regulates bone formation and resorption around the forming tooth and makes eruption happen. Expect this question on board exams. Also expect that you will see a young child in your practice someday who has fallen and intruded an incisor deep into the alveolar bone and into the region of the follicle of the secondary tooth lying just below it. You should know now what problems may develop as that child gets older. We'll review other issues and concepts around this topic in class. See you there.